Hello everyone, welcome back to our channel. Today we're talking about something you probably use every day without thinking much about it, medications. Did you know that some common pills in your medicine cabinet could be risky for your kidneys? Yes, even the ones you pick up over the counter. We'll uncover which medications can cause harm and how to use them safely. Make sure to stick around till the end for some essential tips to protect your kidney health. Don't miss out, and don't forget to hit subscribe for more health insights. While medications are integral to managing various health conditions, it's important to be aware that some common ones can pose risks to your kidneys. These organs work tirelessly to filter and detoxify your blood, but certain drugs can interfere with these processes, potentially leading to reduced kidney function or even significant damage. Today, we'll highlight some of these medications, including those that are often used on a daily basis. Understanding which medications can harm your kidneys and how to use them safely can make a big difference in maintaining your overall health. So, let's get into the details and ensure you have the knowledge to protect your kidney health. The kidneys are two fist-sized organs located just below the rib cage on either side of the spine. Each kidney is made up of millions of filtering units known as nephrons. These nephrons play a critical role in cleansing the blood and balancing bodily fluids. Blood enters the kidneys, and as it passes through the nephrons, waste products and excess substances like water and salts are filtered out. This waste becomes urine, which is then transported to the bladder through the ureters and eventually expelled from the body. Besides filtering waste, the kidneys are also crucial for regulating blood pressure, controlling the production of red blood cells, and maintaining the balance of electrolytes in the body. Essentially, they are chemical labs that manage many vital bodily functions, underscoring why their health is so important to our overall well-being. The kidneys are remarkable for their ability to meticulously manage the body's internal environment. They filter around 120 to 150 quarts of blood each day, extracting about 1 to 2 quarts of waste products and extra water, which are then excreted as urine. This filtration process is central to their function, ensuring that waste materials and toxins are efficiently removed from the bloodstream. But the role of the kidneys extends beyond just cleansing the blood. They are also pivotal in regulating body fluids. By adjusting the volume and concentration of urine, the kidneys balance the levels of various salts and water in the body. This balance is crucial for normal cellular function and maintaining the overall health of other organs. Moreover, the kidneys contribute to blood pressure regulation by controlling the volume of fluids and the concentration of salts in the blood. When the body requires an adjustment in blood pressure, the kidneys respond by altering the amount of fluid excreted in urine. This intricate system of waste removal and fluid balance is vital for keeping the body system stable and functioning correctly, highlighting just how crucial kidney health is to our overall well-being. Medications play a critical role in managing and treating various health conditions, offering relief and improvements in quality of life for many. However, it's important to recognize that these benefits can sometimes come with risks, particularly concerning kidney health. Some medications, even those commonly used for everyday ailments, can have side effects that affect the kidneys. These effects can range from minor, temporary reductions in kidney function to severe, long-term damage. This potential for harm underscores the importance of understanding how medications can impact your kidneys, especially when used frequently or in combination with other treatments. Being aware of these risks and discussing them with healthcare providers can help ensure that the benefits of any medication outweigh the potential harm to your kidneys. As we delve deeper into understanding how certain medications can affect our kidneys, it's important to note that the list we're about to discuss includes both prescription and over-the-counter drugs. Many people may not realize that everyday over-the-counter medications, commonly used for pain relief or to treat minor ailments, can also pose risks to kidney health, just like more potent prescription drugs. This broad range underscores the need to be vigilant and informed about all types of medication, regardless of whether they require a doctor's prescription. Being knowledgeable about these risks helps in making informed decisions about their use, ensuring that we keep our kidneys safe while managing our health. Among the most commonly used medications are non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen and naproxen. These drugs are widely favored for their effectiveness in reducing pain, inflammation, and fever. However, their impact on the kidneys is a significant concern, particularly with long-term or heavy use. NSAIDs work by blocking certain pathways in the body that produce pain and inflammation. Unfortunately, these same pathways also help maintain blood flow to the kidneys. When these drugs inhibit these pathways, they can reduce the blood supply to the kidneys, which can impair kidney function. This reduced blood flow can be particularly problematic in situations where the kidneys already face a challenge, such as in dehydration or heart failure, increasing the risk of kidney damage. Continuous use of NSAIDs can lead to chronic kidney disease or even acute kidney injury in more severe cases. Thus, while NSAIDs are effective for managing symptoms, it's crucial to use them cautiously and under medical guidance to minimize the risk to your kidney health. Antibiotics are another category of medications that are essential for treating bacterial infections, with common examples including ciprofloxacin and methicillin. While these drugs are pivotal in combating infections, certain antibiotics can also pose risks to the kidneys. The mechanism of potential harm varies. Some antibiotics can cause direct toxicity to the kidneys, while others may lead to severe dehydration or interact with other medications, exacerbating their harmful effects. The occurrence of kidney damage from antibiotics generally depends on the dose and duration of treatment, as well as individual susceptibility factors such as existing kidney conditions or concurrent use of other medications. For example, high doses or prolonged use of certain antibiotics can accumulate to toxic levels in the kidneys, impairing their ability to function properly. This underscores the importance of using antibiotics strictly as prescribed by healthcare providers. It's crucial to follow the recommended dosage and duration of treatment and to inform your doctor of all other medications you're taking and your medical history. These steps help ensure that the benefits of treating infections with antibiotics do not come at the expense of your kidney health. Moreover, indiscriminate or unnecessary use of antibiotics can lead to resistance, making infections harder to treat in the future. So judicious use is essential for multiple reasons. Proton pump inhibitors, PPIs, such as omeprazole and lansoprazole, are commonly prescribed to reduce stomach acid and treat conditions like gastroesophageal reflux disease and peptic ulcer disease. While highly effective at managing these conditions, there is growing concern about their long-term use and the potential for kidney issues. PPIs operate by blocking the enzyme system in the stomach responsible for acid production. This reduction in stomach acid can inadvertently affect the kidneys. The mechanism by which PPIs can cause kidney damage is not entirely understood, but it is believed to involve long-term disruption in the body's ability to absorb minerals and produce certain enzymes, which can indirectly impact kidney function. Studies have shown that prolonged use of PPIs can increase the risk of developing chronic kidney disease. This risk appears to rise with the duration of PPI use, suggesting a cumulative effect over time. Additionally, there can be an acute decline in kidney function, known as acute interstitial nephritis, which has been linked to PPI use and can lead to more severe kidney issues if not recognized and managed promptly. Given these risks, it's crucial for individuals using PPIs, especially for long periods, to do so under careful medical supervision. Regular monitoring of kidney function may be advisable for those at higher risk or those who require long-term treatment with these medications. This ensures that any potential kidney issues can be detected and addressed early, minimizing the risk of long-term damage. Blood pressure medications, particularly ACE inhibitors and angiotensin II receptor blockers, ARBs, are vital for managing hypertension and protecting the heart and kidneys, especially in patients with diabetes or chronic kidney disease. Examples of these medications include lisinopril, an ACE inhibitor, and losartan, an ARB. While they play a crucial role in managing blood pressure and reducing the workload on the heart, their effects on the kidneys need careful consideration. ACE inhibitors and ARBs work by relaxing blood vessels and reducing blood pressure, which in turn reduces the strain on the heart and the blood vessels in the kidneys. This mechanism can be highly beneficial in preserving kidney function over time, especially for those with conditions that predispose them to kidney damage. However, these medications can also pose risks to the kidneys, particularly in the initial phases of treatment or under certain conditions. One of the key risks involves a potential decline in kidney function due to the lowered blood pressure. This effect is usually temporary and often stabilizes, but it can be significant in patients who have certain types of kidney disease, where the kidneys rely on a higher pressure to filter blood. Additionally, when used in combination with other medications like NSAIDs or diuretics, ACE inhibitors and ARBs can further increase the risk of kidney damage. Therefore, while ACE inhibitors and ARBs are beneficial for managing blood pressure and reducing risks associated with heart disease and kidney dysfunction, their use requires careful management. Regular monitoring of kidney function, especially when starting these medications or adjusting doses, is crucial to ensure that the kidneys are handling the medications well and to adjust treatment as necessary to avoid long-term damage. Diuretics, such as furosemide and hydrochlorothiazide, are medications commonly prescribed to help the body eliminate excess fluid by increasing urine production. They are used to treat conditions like hypertension, heart failure, and edema associated with liver or kidney disease. By facilitating the removal of excess water and salt, diuretics help reduce fluid retention, lower blood pressure, and decrease the workload on the heart. However, while diuretics are effective in managing these conditions, their action can also lead to potential risks for kidney health, particularly dehydration. As diuretics increase the volume of urine expelled, they can cause the body to lose too much fluid. This excessive fluid loss can lead to dehydration, which in turn can reduce blood flow to the kidneys. Reduced blood flow diminishes the kidney's ability to function effectively, potentially leading to acute kidney injury if not managed properly. Moreover, the loss of essential electrolytes along with the fluids can disrupt the balance of minerals in the body, which is another factor that can adversely affect kidney function. It's crucial for individuals taking diuretics to monitor their fluid intake and ensure they're staying adequately hydrated. Regular checkups to monitor kidney function and electrolyte levels are also important to ensure that the benefits of using diuretics do not outweigh the risks, particularly in terms of kidney health. Lithium is a medication predominantly used to treat psychiatric conditions such as bipolar disorder, effectively helping to stabilize mood and prevent extreme fluctuations. Despite its benefits in managing mental health, lithium's impact on the kidneys, particularly with long-term use, warrants careful consideration. Lithium is processed by the kidneys, and over time, its chronic exposure can lead to several renal issues. One of the primary concerns is the development of chronic kidney disease, CKD. Long-term lithium use can induce a condition known as nephrogenic diabetes insipidus, where the kidneys are unable to concentrate urine properly, leading to excessive urine production and increased thirst. This condition not only disrupts normal life, but can also stress the kidneys, gradually impairing their function. Moreover, lithium can cause changes in kidney structure, including the development of cysts within the kidney tissue. Over many years, These alterations can contribute to a reduction in kidney function, potentially progressing to more serious kidney damage. The risk of kidney function decline is particularly significant for those who have been on lithium for long periods or at higher doses. Given these potential risks, individuals on lithium treatment require regular monitoring of kidney function through blood tests and urine analysis. Adjusting the lithium dosage or switching to alternative therapies may be necessary if significant changes in kidney function are detected. It's crucial for those taking lithium to have a collaborative care plan involving their psychiatrist and nephrologist to optimize both their mental and renal health over the long term. Chemotherapy drugs such as cisplatin and methotrexate are powerful agents used to treat various types of cancer. While these medications are essential for targeting and destroying cancer cells, they can also have potent and sometimes harsh effects on the kidneys, known as nephrotoxicity. Cisplatin, for instance, is known for its effectiveness in treating cancers such as ovarian, testicular, and bladder cancer, but it can also cause significant kidney damage. The drug can affect the kidney's ability to filter blood and maintain a balance of electrolytes, which can lead to acute kidney injury. Methotrexate, used for both chemotherapy and autoimmune diseases, can similarly impact kidney function, particularly at high doses or with prolonged use. It can lead to the accumulation of harmful substances in the renal tubules, causing damage. The risk of kidney damage from chemotherapy underscores the importance of regular monitoring of kidney function during treatment. Patients undergoing treatment with nephrotoxic chemotherapy agents often have their blood and urine tested frequently to assess how well their kidneys are functioning and to catch any signs of damage early. This monitoring allows healthcare providers to adjust the chemotherapy dosage or schedule as needed to minimize kidney damage without compromising the effectiveness of the cancer treatment. Moreover, adequate hydration and sometimes the use of protective drugs that can help shield the kidneys from damage are employed to manage the risk. These measures are crucial for maintaining kidney health and ensuring that the treatment of one life-threatening condition does not lead to another. Thus, while the use of these chemotherapy drugs is necessary, careful management and regular monitoring are essential to balance their benefits against the potential risks to kidney health. When it comes to using medications that might pose risks to kidney health, taking preventive measures is crucial to minimize potential damage. First and foremost, it's essential to use all medications, whether prescription or over-the-counter, according to medical advice. This means adhering to the prescribed dosages and not extending the duration of use without consultation. For medications known to impact kidney function, such as NSAIDs, limiting usage and opting for alternatives when possible can be beneficial. Hydration is another key factor. Ensuring adequate fluid intake is especially important when using medications that can lead to dehydration, like diuretics and some chemotherapy drugs. Proper hydration helps maintain sufficient blood flow to the kidneys, facilitating the safe and effective filtration of substances, including medications. Moreover, some medications require adjustment of diet or the management of other lifestyle factors to reduce kidney strain. For instance, maintaining a balanced intake of electrolytes can help mitigate the risks associated with medications that alter mineral balance, such as diuretics and lithium. Regular checkups are vital for anyone taking medications that can affect kidney function. These checkups should include kidney function tests, which typically involve blood tests to measure levels of creatinine and blood urea nitrogen, BUN, and urine tests to assess for the presence of proteins or other substances indicative of kidney damage. Regular monitoring allows for the timely detection of any changes in kidney health, enabling adjustments to treatment before substantial damage occurs. By combining these preventive strategies, careful medication management, adequate hydration, dietary considerations, and regular medical monitoring, individuals can significantly reduce the risk of medication-related kidney damage, ensuring both effective treatment of their conditions and the preservation of their kidney health. Today, we explored how certain common medications, including NSAIDs, antibiotics, proton pump inhibitors, blood pressure medications, diuretics, lithium, and chemotherapy drugs, can potentially affect your kidney health. While these medications are crucial for managing various health conditions, it's important to be aware of their potential side effects on the kidneys and to use them judiciously. Remember, whether you're dealing with a temporary condition or require long-term medication, it's essential to consult with your healthcare provider before starting or stopping any medication. They can help you navigate the risks and benefits, ensuring that your treatment plan is safe for your kidneys and effective for your overall health. Thank you for joining us for this important discussion. If you found this information useful, don't forget to subscribe to our channel and click the bell icon so you won't miss our upcoming health-related videos. We're here to help you stay informed and keep your health on track. Take care and see you in the next video.